Hi everybody, and welcome to our first of 3 videos on the lymphatic system. In today's video, we're going to cover first the anatomy of the lymphatic system, how it differs from the cardiovascular system, and all of the organs and tissues that are going to be at play. In the subsequent videos, we're going to focus primarily on the immune system and how it works. So let's get started. First off, when we look at our lymphatic system, it does look very similar to your cardiovascular system. We have a lot of vessels that are ranging in size from small to medium to large, and it has a very similar function. So within your lymphatic system, we do have a fluid. This fluid is called lymph. And basically what it is the fluid that's in your tissues, so surrounding your tissues. Remember, as the blood goes through your capillary bed, it's going to push the fluid and nutrients into the tissues, and it's going to draw most of that back in, but not all of it. So part of the job of the lymphatic system is to return that excess fluid. It's also important in transporting fats or lipids, and we'll get into all of that when we hit our digestive system. But just as a little teaser, when you eat food, your sugars and your amino acids are all absorbed directly into your bloodstream, but fats are a little different, and they have to be packaged and sent through the lymphatic system first before they get into the cardiovascular system. And then our main focus for the last 2 videos of the lymphatic system is its third function, which is to carry out immune responses, aka fighting against pathogens. Now, the very smallest vessel that you'll see in the lymphatic system is also called a capillary. Now, these differ from the capillaries we looked at in the last chapter in that, one, they're bigger. So they're still pretty small relative to vessels, but they are bigger than an actual blood capillary. This is so they can gather more fluid, and fats are also rather large, so it lets them move in a lot easier. The other big difference about a lymphatic capillary is you'll notice it's not connected at the end. So lymphatic capillaries only provide one way of access. So fluid can come in through these little clefts, but they seal, so it can't drain backwards. And that's really important because the whole purpose of this system is to get the fluid out of the tissues. So if we let it just go into the tissues as well, it would cause a problem. So how do we move this fluid? Well, again, we're going to start at the lymphatic capillaries, picking up that excess that the blood capillaries cannot. They move to larger structures called vessels. Then they go through your lymph nodes. You guys have probably experienced swollen lymph nodes before, either in your neck or your armpit. And these are important for sort of filtering and kind of surveilling what's inside the lymph. And we'll get to that later in this lecture. And then the last thing that we have are the lymphatic ducts. These are 2 very large structures, very similar to the size of the aorta or the vena cava. And we have 2 of them. So the right thoracic duct is going to drain the right side of the head, chest, and arm, and the left side is going to drain everything else. Why isn't it even? It all has to go back to fetal development and how things were sort of moved and compartmentalized, which is a little bit beyond this particular course. Now, once the fluid is in the lymphatic ducts, those actually directly drain into your subclavian veins, which again are going to be right here underneath your clavicle, and then everything is back in the cardiovascular system. Now, there is a complication that can occur called lymphedema. Lymphedema is where there is swelling in the tissue due to damage or removal of lymph nodes. Now, this is different than just regular edema, which we kind of looked at when we talked about heart failure. Edema just means fluid in the tissue, and that is usually caused by an imbalance of the pressure in the capillary beds, right, due to declining heart function. Lymphedema produces a similar result in that you do have swelling, except it's typically not bilateral, so we don't see it on both sides, and its cause is not because of a heart issue, but because of damage to lymph nodes. Now, how does this happen? There's lots of different ways. The two that I want to talk about are, first and foremost, something that's a little bit more common, which is removal of lymph nodes due to breast cancer. So a lot of the times when a woman has breast cancer, when they go in to remove the tumor, they will also remove lymph nodes that are in the axillary or armpit area, because that's the first place that the cancer typically will spread. Now the problem is, in some people, not all, and we still don't know why, this can lead to problems with the return of the fluid from the capillaries and vessels in the arm. So it disrupts the flow back into the venous system, and you get this swelling on whatever side of the body you had the breast cancer and removal of the lymph nodes. Treatment can vary. Oftentimes there's use of compression sleeves, physical therapy. Sometimes there will be surgery involved, but it really depends on the patient. Now, the other way we get lymphedema is through this little guy right here. This is a parasite, a filarial parasite called Roucouraria bancrofti. No, we don't have this in America. It's just a really cool thing to talk about. This little dude will live within the lymphatic vessels, and it will basically block the flow through the lymph nodes, leading to what's called lymphatic filariasis, where again you would get this swelling that's unilateral. It typically is seen in the lower extremities because this is absorbed typically through the foot sometimes. Worm will go through your foot. And kind of like onchocerco. And the typical viewing of symptoms, again, is either going to be in the right leg or the left leg, and in males it can also lead to edema of the scrotum. So it can be pretty severe. Mostly it is not quite life-threatening, but it does cause pain and annoyance. Now, aside from the vessels, we also have organs and tissues, and they are grouped into two categories, primary and secondary. The two primary organs that we have are the red bone marrow and thymus, and the secondary lymphatic organs and tissues that we have are things like the spleen, the lymph nodes, nodules, and then aggregates of tissue that we'll talk about later. How do they differ? The main difference is what is happening at that location. If that organ or tissue is responsible for producing and maturing T cells and B cells, it's a primary lymphatic organ. Basically, that means if we do not have that organ, we are immunocompromised. So we won't be able to make the B cells and T cells. If the organ or tissue is where we mount an immune response, they're considered secondary lymphatic organs or tissues. Does removal of them sort of make us a bit immunocompromised? Yes, but not to the same degree as if we didn't have a working thymus or red bone marrow. So we're going to go through all of these, and then we'll be able to talk about how we use these organs and tissues in our immune response. So the first one we're going to look at is the thymus, and it lives right behind your sternum, okay, on top of your heart. This is where immature T cells are going to go and basically be trained. I like to kind of think of it like Hogwarts. So you might have been born into a magical family, or you have magical aptitude, but you can't learn it on your own how to use it. So you head to Hogwarts to train your magical skills. That's what happens here with T cells. They're made in the red bone marrow, but they learn how to be a T cell in the thymus. Now, what's very interesting is this is a very competitive and rigorous school, as it were, where only about 2% of the T cells that go there actually survive. They're basically put through a bunch of trials where they have to make sure they react to foreign antigens but don't react to our own antigens or cell markers, and it's a pretty complicated process. Once they've passed the test, they are then basically deployed out to the secondary lymphatic organs and tissues to basically hang out and wait to be activated. Now, the spleen is the first of our secondary lymphatic organs. You'll notice we're not talking about the red bone marrow. We've discussed that before when we talked about blood, and we're going to talk more about B cells when we get to our discussion of antibodies. So your spleen is actually going to be on your left side, just kind of underneath your rib cage, and it's this kind of purple-gray organ. Its job is twofold, actually. It has a lymphatic job in that we hold lymphocytes there, and as the blood goes through your spleen, again, we're kind of surveying, filtering, and seeing, is there anything bad there? So we can mount an immune response from the spleen. And it also is important in basically the cardiovascular system. It will help remove old blood cells. Remember, they only live about 100-120 days, and it's going to be a major site of platelet storage. So if we are bleeding, your spleen can sort of squeeze out extra platelets to help with clotting. So if we look at a cross-section here of our spleen, you'll see there's two different colored tissues. We have red pulp on the outside and white pulp on the inside. The red pulp, as you would kind of expect, this is where we have red blood cells, and this is kind of where their sort of cardiovascular work is being done. White pulp is where we're going to have lymphocytes and macrophages. So these are the ones that are looking around for bacteria, viruses, etc., to mount an immune response. Okay, so that's the difference. White pulp is like your white blood cells for immunity. Red pulp is for red blood cell and platelet work. Now, this is a lymph node. Again, like I mentioned earlier on, a lot of you have probably had swollen lymph nodes here underneath your jaw or in your neck, possibly in your armpit or groin if you've had infections in those areas. And the purpose of your lymph node is they're basically filters. They are kind of scanning the fluid that's coming through and recognizing and mounting an immune response locally if there is an infection. We have them scattered in clusters throughout our body in lots of different places. The three important ones sort of clinically are going to be your cervical lymph nodes here in your neck, your axillary lymph nodes in your armpit, and then you have your inguinal lymph nodes in your groin. These ones are going to, again, swell typically if you're having an infection in that area. They can also swell in the case of cancer. So keeping an eye on lymph nodes and nodules and lumps you may feel is really important because it could be an indicator of cancer. Now, the lymph node, again, you can see it has all these vessels sort of coming into it and a few that are exiting. And then within this lymph node itself, it's going to have areas that have different populations of B cells and T cells. So here's what your lymph node looks like. We have all these little areas for B cells and T cells to live in. And you'll notice again first, we have a bunch of afferent vessels. Remember afferent, like we talked about in the nervous system. These are going to come into the lymph node. And then we have very few efferent or exiting vessels. The idea here is if I have more lanes of traffic coming in and fewer lanes coming out, it's going to create a backflow. And so it gives time for that lymph to percolate, go through these various areas and layers of your lymph node, giving those B cells and T cells a chance to see if there's anything there that they need to mount an immune response for. Okay? Now the next type, I should say, of secondary lymphatic organ that we have are lymphatic nodules. And again, some of you are pretty familiar with these. If you've ever had tonsillitis or had your tonsils out, they are lymphatic nodules. So at the very back of your throat, right here, this is your fauces, the opening, there's your uvula, the little dangly dude. These are your tonsils. And we actually have a bunch of different types of tonsils, but their job is there in that back of your throat, known as the pharynx, and they're basically monitoring foreign things that are getting inhaled through your nose or mouth or being ingested. And if they recognize a pathogen, they will, again, mount an immune response and begin to swell. So tonsillitis is often very painful because you have swollen tissue, and then it makes it difficult to swallow and eat, and it is very gross. I think that's a tonsil stone there. They can create these calcified stones that you can pop out. Fun fact, back in the day, the way they used, and I mean like a while ago, they used to get rid of tonsils with a fingernail. Just put their finger right in there. So that's pretty cool. You can have your tonsils removed, a tonsillectomy, if you do have recurrent tonsillitis, but they can grow back. So that's kind of a fun little side effect. Another type of lymphatic nodule that we have that you're probably not aware of are called Peyer's patches. This is a cross section of your small intestine on the microscope. This is where your food would be, and this is the outside of the intestine. And you'll see these very dark colored circles here. These are aggregates of lymphatic tissue that, again, are there to monitor things that are being absorbed and that are running through your intestines. So if you do have an illness, it can mount a local immune response. There are also other types of tissues that you have spread out throughout your entire body. We have fun little acronyms for them like SALT and MALT and GALT. And basically they're just little tissue areas that, again, act as little fire stations or little police stations, so that if there is a foreign pathogen, they can mount that local immune response while they wait for sort of the whole immune system to get there and put the fire out, so to speak. So that is the anatomy of your lymphatic system. In our next video, we're going to take a look at how the lymphatic system mounts an immune response and what types of immune responses we have. And I'll see you then.